Thanks for joining us once again here on Senior Mark TV. Today we're going to continue our series on Medicare alphabet soup. What do all the letters mean? If you remember last time, we kind of summarized a little bit on the 4 parts of Medicare and what they cover. We kind of just summarized Part A, Part B, Part C, and Part D. As you can see here, Part A is hospital insurance, Part B is medical insurance, Part C is the Medicare Advantage plans, and Part D being the prescription drug plans. So today, last time we covered in detail what Part A covers, and today we're going to continue and go on to Part B and explain in more detail what Part B covers. So when you're looking at Part B, some of the things that Part B covers, in essence, Part B covers everything that's not related to an inpatient hospital stay. Some of those things being physician services, outpatient medical and surgical services and supplies. That would be anything from an outpatient facility. Physical and speech therapy, any diagnostic tests that you might have, x-rays, MRIs, CAT scans, that sort of things. Durable medical equipment, and finally, any blood that you would receive from an accident or for a surgery. When you go into the detail of how Part B covers, for most of those services, you would be responsible to pay the first $155 each calendar year. So that would be what's referred to, you always hear it referred to as the Part B deductible. That's $155 per year. Again, these are 2010 numbers. These do typically go up from year to year, and Medicare makes those decisions. After you would pay that $155 deductible, Medicare would pick up 80% of the bill, and you would be responsible for paying 20% of whatever that Medicare approved amount would be. I've included a link. If you look above this video, there should be a link there where you can get a more detailed list on some of the Part B services and how they're covered, because certain services Medicare will cover and you don't have to meet that $155 deductible first. So there are some that are covered more extensively than some of the other ones. So go ahead and click on that link and it'll open up a file that will have that list for you. There's another thing that's called excess charges, and what excess charges are is when a provider charges you more than the Medicare approved amount. Now in Ohio, providers have to accept what Medicare approves. So if a doctor charges you $150 for an office visit and Medicare only approves $100 of that, that doctor has to accept that $100 as payment in full. Now that's not the same from state to state. Other states, they can charge you up to 15% more than the Medicare approved amount. And there are only 7 states, one of those being Ohio, where the doctors have to accept. So there's a lot of states out there that they can charge you more than the Medicare approved amount. Next thing is Part B. How does it cover blood that you would need? You would have to pay 100% of the cost of the first 3 pints of blood that you would need. Now there are circumstances where if your family donates for you that you wouldn't have to meet that, but if you're just receiving blood in general, you pay 100% for the first 3 pints. After the first 3 pints, then Medicare, it would follow the $155 deductible and the 80-20 rule. So if you haven't met the $155 deductible yet for the year, that would apply. So that, in essence, that's pretty much how Part B works in most cases. Very simple, but a lot of times people just don't understand it. So thank you for joining us. Again, if you haven't done so already, go ahead on the right side of your screen, input your email address, click subscribe me, and you'll subscribe to our blog. Leave a comment. We love to hear your feedback. We'd like to know, what we're doing that's good and what things you'd like to see in the future, maybe some topics that you're unclear on, some of the changes that might be going on with the new healthcare reform. And also tell your friends to visit us at Senior Mark TV. Thank you very much.